Here are 5 shoulder injuries that might be mistaken for a rotator cuff tear. The first one is shoulder impingement syndrome. All this is the space right here. This is the shoulder joint. Right here where I'm sticking my finger is under this overhanging bone of the shoulder blade called the acromion. When that space right there gets pinched because it decreases, they call that shoulder impingement syndrome. Now, the reason for the decrease in space is kind of ambiguous. Medical professionals don't really know. I'll give you some reasons in another video probably, but that injury is associated with the beginnings of a rotator cuff tear. And the key difference in a rotator cuff tear versus shoulder impingement is that you still have your full range of motion. You can still go up all the way. You can move everywhere. It just hurts to do it if you have shoulder impingement. And it tends to get worse if you do repetitive or forceful activities like upper body exercises or yard work that involves a lot of arm movements, but it doesn't limit your motion typically. Once your motion starts to become limited, then we're leaning more towards having a rotator cuff tear. Number 2 is a shoulder strain. Now, this is typically associated with having some injury where you fall onto your shoulder, like on the side of your body right here, or you fall and you put your hand out to stop your fall, and you fall on an outstretched arm that jams the shoulder joint, and that's what's called an acute injury, meaning you just got it and it's associated with an accident of some sort. It could be a car accident, could be a fall, bicycle accident. That is like a quick stretch to the tissues, to the tendons, but it didn't tear them necessarily. That's a strain. It could be the muscles that were affected as well. People will typically recover from this fairly quickly, and usually their motion is not limited, whereas with a rotator cuff tear, it does tend to be limited. So that's how you can tell the difference between the two. Number 3 is biceps tendonitis. Now, the bicep muscle, the flexing muscle right here in the front of your arm, has 2 tendons that come up. One of them comes more towards your chest, and the other one goes right up into the shoulder. Right here on my shoulder model, it's this muscle. This is the tendon. It's this ropey thing that goes up into the shoulder right along with the rotator cuff tendons. Now, it hurts in the shoulder sometimes. Sometimes it goes down into the upper arm a bit, and it often hurts with upper body movements and exercises, especially with reaching up overhead, because you can put some pressure on it and strain. Now, the way that you can tell the difference is it will hurt right here in front, right where that ropey tendon is. If you dig in there and rub it, you can usually find the ropey tendon and strum it like a guitar string back and forth, and it won't be as tender typically on the other side unless you also have biceps tendonitis there, because that happens often where it happens on both sides. The biggest difference though, the key difference between biceps tendonitis and a rotator cuff tear is limitations in motion again. If you have a rotator cuff tear, your motion is going to potentially be limited, especially with coming up. But with a biceps tendon problem, as long as it's not torn, it's just tendonitis, then you're going to have just pain in the shoulder whenever you're reaching in certain directions. Number 4 is bursitis. A bursa is just a fluid-filled sac in the body, usually around joints, that's there to reduce friction between different things like tendons and bones, or tendons on other tendons. It's just there to keep the friction down so that you don't tear things. The problem is if you begin to put too much pressure through the area, then you can get what's called bursitis. Itis is just added on to bursa, and it means inflammation. So it's inflammation of a bursa. Right here where I'm sticking my finger is what's called the subacromial bursa. That's the name of the specific bursa that's there. And this is very connected to shoulder impingement syndrome. In fact, you really can't tell the two apart unless you have some sort of diagnostic imaging, like an MRI or maybe even an ultrasound that can detect swelling or inflammation in the bursa. So you kind of have to go to the doctor and get this teased out. But the good news, in case you want to try to stay away from the doctor's office, is it's the same root problem that's setting up shoulder impingement and bursitis and a rotator cuff tear. They all kind of fall on the same spectrum. If you let the problem fester long enough, you just kind of get all of them together. Again, the key difference here is you'll have all your range of motion. It just may be painful to come up, but with a rotator cuff tear, you start to lose some motion with pain, of course, but you also can't physically get up, especially if you have a complete tear. And number 5 is a labrum tear. The labrum in the shoulder joint is a rubbery cartilage ring that goes around the socket side of the joint. And its job is to allow some extra flexibility in the shoulder while still keeping the ball and socket joint congruent so that it gives some stability. If you tear your shoulder labrum, it's bad news because it's a cartilage injury, and cartilage is one of the slowest healing tissues in the body. Now, it's not catastrophic news. You can heal from it. There's a lot of people that are out there functioning just fine in their arm, maybe occasionally have some pain, and they actually have a shoulder labrum tear, but it's not stopping them from doing things. They're not going to the doctor, constantly living with pain. And there are some people that have that situation. They have to go get surgery for that. But if you have a labral tear, you will have a restriction in motion. The key difference here is because now you've lost stability in your shoulder, you're going to get some clunking, popping, or clicking in your shoulder that's consistent. Every time you move your shoulder a certain way, clunk, it'll pop or click. That's very consistent with having a labrum tear. And that's not always present when it comes to having a rotator cuff tear. There isn't a ton of popping and clicking. There might be some, but not super consistent where you can find that way to move your arm and it always pops and clicks. That's more associated with a labrum tear. Now, if you're sure that you have a rotator cuff problem and you're looking for help with it, we've got tons of videos to help with that. There's a link in the description below that has all our rotator cuff help videos. And I've also linked some other playlists down below that can help with other shoulder problems that I've mentioned here in this video. Hey, if this video was helpful for you, please give us a thumbs up. Please also share this video with somebody you think needs to see this. And don't forget to subscribe and hit the notification bell so that you don't miss out on each and every video that we post every week. Thanks so much for watching. I'll see you in the next video. Bye-bye.